So I'm trying to look at the sternum. So the sternum, we're trying to look at the different parts of the sternum. So the different parts of the sternum, we're trying to look at the clavicular notch. Okay, no, not clavicular notch. We're not looking at notches yet. Looking at the sternum. So the different parts of the manubrium. We're looking at the body, which is the gladiolus. Then we're also looking at the pointed part down, which is the Xiphoid process. Okay. So for the sternum, what you got is this. The sternum is also known as the breastbone. Okay. These are the introduction before the parts. So it's a flat bone and it's located at the center of the front of the chest. Serves as a key attachment point for ribs and clavicles. So manubrium is the upper portion of the sternum. Okay, articulates with the clavicles at the clavicular notch. So this is a clavicular notch. The clavicles will fit there. Articulates with the first pairs of the rib and the parts of the second pair. It has a jugular notch, which is a palpable landmark. Okay, if I'm palpating and I meet the jugular notch, I know that I'm actually at the head of the sternum. So it also has the body, which is also known as a gladiolus. Is the middle and is the largest portion. Is the longest too. Articulates from rib 2 down to rib 7. So it has what is known as the sternal angle of Louis. Alright. Then function, it forms the main structure of the sternum, anchoring most of the ribs. They also have the Xiphoid process, which is kind of like the inferior and the smallest portion of the sternum. Xiphoid process is kind of like pointing down. Xiphoid process is pointing down. So that's what we got. So it's variable in shape, ossifies later in life. The Xiphoid process will fully mature only when you're at age 40. Okay, so it provides attachment for the diaphragm and the rectus abdominis muscle. It serves as a point where different muscles are actually coming together to insert there. So clinical notes is the sternal angle is very important. Sternal angle of Lewis, we'll get to discuss it. What again? All those chest compressions. As you are pressing the chest to be able to resuscitate a person, you are pressing the sternum. So sternal fractures, when there's all those traumas, you have the fractures, you can use it for bone marrow aspiration too. So I think that's the beauty of this, and that is what we got.